Hello there, my name is Yudi and this is the Yudi Factor, a program that understands that knowledge is power, and therefore week after week we discuss issues and empower you with information to enable you make informed choices, especially when you factor in something you heard on the Yudi Factor into your situation. Today we're going to be talking about IVF. In 1978, the world woke up to Louis Brown, and that was by Dr. Steptoe and Edwards. That really brought hope to infertile couples. And then in Nigeria in 1984, these distinguished gentlemen carried out that feat in Nigeria. Distinguished Professor Osagie, OON, and also Professor Oladapo Ashiru, OFR. They brought hope to thousands, I dare say millions of infertile couples, and therefore brought hope, joy, and laughter to many homes. Today we're going to be talking to them and they'll tell us what propelled them, considering the fact that Nigeria is a very traditional society. Even today, when people are so exposed, people always hide the fact that they actually had an IVF baby. So today, we're going to talk to them, and they'll try to find out what pushed them, and maybe the brick walls they met at the time, or maybe the traditional beliefs at the time, and what hindered them, and what also propelled them to succeed. Don't go anywhere. We'll be right back. We'll see you after this time out. You're welcome back. In Nigeria in 1984, these distinguished gentlemen in front of me carried out that feat in Nigeria. Distinguished Professor Osagie, OON, so you're welcome.
Thank you.
And also Professor Oladapo Ashiru, OFR, Chief Medical Director, Medical Arts Center.
Yes.
Profs, I'm humbled. I'm really humbled. Thank you very much for finding the time in your busy schedule to come and talk to us.
Definitely.
Yes, in 1978, Louis Brown was born. And then you performed the same feat, 84. Well, we'll get to hear the stories. And then 85 was the real thing. Before we go into that, can you tell us, considering the fact that Nigeria is a very traditional society, considering that when it comes to exposure, some of us are so exposed, but there's certain traditional beliefs that hold us down, that even today in this day and age, people who have their babies by IVF don't talk about it. So, what propelled you at that time, considering the Nigerian society?
Well, as you know, I'm a gynecologist.
Yes.
And my area of special interest, right from when I was lecturer at King's College Hospital, London,
Yes.
has always been infertility and family planning.
Yes.
And coming back to Nigeria in 1978, we found that there were a lot of women who were infertile because they had blocked tubes. Tubes were blocked from infection, from abortion, from, in some cases, having babies in an unhygienic environment. And the normal thing we did was to give them antibiotics and operate on the tubes to open them. If we were lucky, the tubes will open at the operation, only for you to find that 6 months later, they are blocked again by the healing process that goes on normally. So it was a very frustrating situation. The Europeans and Americans, first of all, faced it by doing what they call microsurgery, operating on the tubes using microscopes that enlarge what you're operating on by up to 40 to 100 times. And but even then, you found that the overall results, if they are lucky, in highly selected patients, could never be more than 50%. Secondly, those techniques were not really applicable to our women here, because while you could open one tube in a European woman because she has only one tube blocked, or there was blockage in just one area of a tube, the typical Nigerian woman with blocked tubes, the tube will be blocked in more than one place. And both tubes will be blocked, and in some cases, you couldn't even see the tube when you opened the woman up. The openings were just plastered up with what we call adhesions or scar tissue. So that was the background. That's what we met in 1978. I came back to Nigeria, and Professor Ashiru came back from, I came from England, he came from America, where he had been doing a PhD on hormonal regulation of crucial hormones that control fertility in laboratory animals. So we met at a meeting of the Lagos University Medical Society. And then afterwards, he struck the two of us that, look, why can't we work together? He will do the scientific laboratory aspects, I will do the gynae aspects, recruit the patients, and collect the eggs and give to him to fertilize in his laboratory. Luckily at that time, he had a grant from Rockefeller Foundation that allowed him to have equipment that we would normally not have had. And then he had a very bright chap called Abisogu, Dr. Abisogu, doing a master's program under his supervision. So they went on with that. And I used to go regularly to his lab to see how far they were going. And once they succeeded in laboratory animals, I told him that, well, let's have a go at the human. So we got into it because the results of treating tubal disease were very bad in Africa generally and in Nigeria. My own background was that Robert Edwards, who was the scientific hand in the Steptoe and Edwards combination, yes, was my lecturer at Cambridge University. And in the second year physiologist lessons, he used to tell us about fertilization of rabbit oocytes, eggs. And we used to laugh at him, students. I would say, we've come here to study human medicine. This man is telling us about rabbit eggs. And 10 years later, they produced a baby through it. That's the irony of it.
So, Prof, when he first came to you with this idea, how did it feel?
Well, it was an idea that fitted into my own objective. Okay. As you said, although I had the Rockefeller grant, yes, to do a lot of research, but it was for male family planning, okay, to prevent us from populating our environment. But the truth is that the same equipment that you use to do research in any area of reproduction can be used for fertility as well. So, and by the time we succeeded in fertilizing the rat embryo, fertilizing the egg in the incubator, yes, and getting embryo, and getting them to be pregnant and delivering babies, yes, then we knew that we have perfected that technique. It's now to move to the human level. So it was a very good interaction that has become fruitful in the sense of science meeting with clinical medicine.
The first woman you talked to about the IVF thing, how were you able to convince the person?
Well, it's important to know that women who have that challenge, even till today, tend to be desperate. And they would do anything to try and have a child of their own. And of course, how desperate they get, because there are cases in recent times of child stealing, etc.
Yes.
So these are desperate women. I've had a very wealthy trader, typical Yoruba female trader, bring her property documents to my clinic and say, look, take these, just do whatever is necessary to give me a baby. And of course, if I was an unscrupulous doctor, I'll take it from her, maybe get her to sign that she gave it to me. And her. So these are desperate people. So when you offer that glimpse of the possibility that they can actually have children, they grab it with both hands.
I think also it's important to know that as at that time,
Yes.
when we started the human work, 1983 precisely,
Yes.
Step 2 and Edward were just about 5 years old in their own process too. But the Bornhole Clinic was crowded by people from all over the world. So they had waiting lists. So it was therefore easy for some Nigerians to say that, well, if you're going to do it for us here, let's try it.
Hold the thought, Prof. Hold the thought. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, this is the UD Factor, and we are talking with Professor Oladapo Ashiru, OFR, and distinguished Professor Osagie, the doctors who produced the very first test tube baby in Nigeria. And they're taking us through the process that led to their partnership that produced that baby. Your very first patient. What did you say to her?
Well, usually they will present in a gynae clinic at Luth.
Okay.
And they would have been documented, you know. Many of them had had operations 2-3 times in various places trying to open their tubes. So we would then say to them, look, there's this technique that is called test tube baby, because that is,
That was what it was
most
then.
of them could not cope with in vitro fertilization.
Yeah.
And this is how it's done. We'll stimulate you, collect the egg, add your husband's sperm, and then if it fertilizes, put it back into you. You know, when you do it that way, it sounds very straightforward.
Yes.
But it contains a lot of complications. And they will say yes, and it was affordable. In those days, it was affordable, partly because the laboratory aspect, as Professor Ashiru mentioned, many of the things we needed were already in his lab from his research grant from Rockefeller Foundation. Yes. And our own side was to select the patients who could benefit from the process. So there was no problem in their accepting. Of course, at that time, everything was done under GA, general anesthesia, yes. And then you had to do what they call laparoscopy in theater to collect the eggs. In fact, that's where the fear came in. Mm-hmm. Once you mention you go to theater, or else they think that theater means cesarean section or fibroid operation. So that's where we had to do a lot of awareness creation. Mm-hmm. And but as I said, it was affordable then. They could do the typical market woman could save for it and do it.
Also, you know that the laparoscopy, the woman ended up with 3 cuts in the abdomen and has to be in the hospital because there is a cut in the abdomen. Yes. If you compare that to the way IVF is done today, yes. There's no cut in the abdomen. There's only a probe that goes through the vagina, and there's a needle puncture only. So it can be done as an outpatient. So they come in low sedation, yes. And then they can leave after, within an hour. So that is how it has been simplified. But then
it was
difficult.
when you implanted the fertilized eggs, and then the woman was pregnant. The first time you discovered the woman was pregnant, how did you feel?
Well, just to give some further details,
Yes.
you know, we collected the eggs in the modular theater at Luth. Then the eggs were transferred across the compound to Professor Ashiru's laboratory,
Yes.
which was like about maybe 400 yards away,
you know,
in a water bath. It was when it got there that they will now start sorting them out.
Yeah.
So,
apart from when we collect the fluid
Yes.
in a test tube, the follicular fluid aspirated
Yes.
under anesthesia, and we take those fluids in test tubes, maybe about 6 or 8. Then we take that to the lab in a water bath to maintain the temperature. Then we now identify the eggs in those follicles under the microscope. The eggs are now inseminated with the sperm and now incubated for 3 days. Okay? We watch the division on a daily basis, and on the 3rd day, we take those embryos load it in a catheter. Okay? Then we take it to the
go back to theater
and then transfer it.
Wasn't that stressful?
Well,
compared to today?
It took a lot of organization.
Yeah, but
at that time,
yes.
it was only Egypt, Nigeria, and South Africa, in the whole of Africa, that were doing IVF. The IVF program at Luth, which Professor Ashiru and I started, was the first, not only in Nigeria, but the whole of West Africa, the whole of East and Central Africa. We were the first.
Correct.
There were only IVF going on in Luth, in Lagos, in South Africa, and Egypt. So you can imagine that a lot of people were skeptical. How can they say they are doing IVF? That was a common comment by our colleagues. And some out of genuine lack of knowledge, but some out of great envy that these people are carving a new route. And
but you know,
you will hear some more about that.
Even I wanted to say that movement from the lab in anatomy department.
Hold the thought, Prof. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, we're talking about the journey of IVF in Nigeria, and I still have my guest. So, Prof, yes.
Yeah, what I was saying, that movement from the anatomy department laboratory into the modular theater, about maybe 300 to 400